many of us are dealing with patients who have either had COVID, have long COVID symptoms, or are long haulers of COVID. There are millions of people. I mean, estimates are that now 21% of people who have gotten COVID will have symptoms longer than 4 months, and they would be categorized as being a long COVID individuals. Number one. Number two, everybody's different. One size doesn't fit all. So you might be seeing, in my practice, half of my practice are long COVID patients. Each one presents differently with a different set of clinical concerns. And it really makes the clinician sit down and take a system by system approach in understanding how to manage these patients. So our objectives for tonight is to try and understand the pathophysiology of COVID. We're going to look at long COVID. And now it's pretty well accepted that the following three major symptoms make up patients who would be experiencing these symptoms having long COVID. Fatigue, which would imply mitochondrial dysfunction, exercise intolerance, and neurocognitive disturbances or neuroinflammation, which we're going to talk about, and comparing long COVID to chronic fatigue syndrome and myalgic encephalitis. We're going to do a systems review because there are certain things that are hallmarks within the conversation of long COVID, such as gut dysbiosis and gut permeability. I don't like to use the word leaky gut anymore because really in the medical literature, it's more referred to as gut permeability. But the one thing to walk away from, it's not just gut permeability. We have lung permeability, brain permeability, or leaky brain, leaky gut, leaky skin. So the idea that barriers are being broken down and this translocation of bacteria, usually gram-negative bacteria or lipopolysaccharides, seems to cause this excessive inflammation. And ultimately, as you'll see if you haven't seen in your practice, the resurgence of autoimmune or the presentation of autoimmune conditions and the reactivation of viruses. So we really come down to, as a functional medicine practitioner, the understanding the why. Why is the patient presenting this particular way? What are some of the underlying causes? And certainly we want to get into the understanding that we want to be treating patients upstream. Unfortunately, most patients enter our office, they're already downstream. They've gone to an allopathic physician and they do a great job in diagnosing. And this is the area where a functional medicine practitioner really can rise to the top, because most allopathic physicians don't know what to do with these patients. And the pure numbers, when we look at the fact that it's up to 21% and probably 65 to 70 million people have symptoms suggested of having long COVID with over 200 conditions. I mean, this is almost a given for a functional medicine practitioner to integrate and use the tools that they have acquired over the years of practice, reading, learning, etc. We're going to look at some nutritional support and some clinical pearls that I think are important. Now, to give you an idea where this is at, an article was published today that basically says that in the last 5 days, over 95 articles have been published in peer-reviewed journals about long COVID. So the information is coming fast and furious, and it really takes the clinician all of their thinking tools or to really think about how they want to manage these patients. So the current definition, or by the government, is that signs and symptoms and conditions are present 4 weeks or more after the initial phase of infection. And the real key is understanding that it's multi-systematic. It's not just one system. It's not just affecting the respiratory system. It's looking at the nervous system, the brain, the endocrine system, the musculoskeletal system, just about any system that you can think of in the body in some way, shape, or form has been affected by the SARS-CoV-2. So, and this is an article that I think is a mainstay. Most of the articles that I'm presenting tonight are those kinds of articles that you can find. And this is an article that looks at there's more than 200 symptoms identified with long COVID. and at least 65 million people. Now, remember, this is not just in adults, because who's very vulnerable or has weakened or compromised immune systems, or immune systems that are being educated? The young. And although these key findings are critical to understanding long COVID, current diagnostic and treatment options are insufficient. And hence, that's where I feel the functional medicine practitioner can really shine in terms of evaluating these patients and creating a protocol for them. And in a recent USA Today article, it was stated that long COVID costs the US economy $200 billion a year. So that's $2 billion over the next decade. So it's not just the patients having all these symptoms. How does it affect their family? How does that affect their job? How does that affect literally everything in terms of how they function? And I've seen patients in my practice with long COVID who have been, well beyond a year. And it truly is remarkable to see what you can do from a nutritional perspective. So we know that there is a number of different things that are going on with long COVID, that there are a number of predisposing factors. There's psychological stress, immunosenescence, neuroinflammation, and comorbidities. Now, originally, early on, they started to look at, and you're probably all familiar, who was more vulnerable. Well, women were, African Americans, people who were vitamin D insufficient, people who were overweight, people who had insulin resistance and blood sugar abnormalities. And then they realized that what's all linking them together is inflammation. But we know there's persistent inflammation and neuroinflammation. We'll talk about that. Persistent infections and viral antigen loads. They have found patients who have SARS-CoV-2 viruses in people a year after their initial infection. Mitochondrial dysfunction. So think about a person, number one, you're using a lot of energy just to deal with your sickness. One of the concerns with patients with long COVID is the fact that they have issues getting enough oxygen to their tissues. A big one is endothelial dysfunction, which we'll talk about, how small blood vessels are impacted. I've had numbers of patients who post-COVID have had mini strokes as a result. We'll discuss dysbiosis and changes in the gut microbiome. How does that impact this gut-brain axis, this communication, and most importantly, dysbiosis and inflammation in the gut causes more inflammation. Reactivation of other viruses, I've talked about. It's very common to see patients reactivate herpes, EBV virus, and other forms of viruses. We'll talk a little bit about it. We know that there are T-cell abnormalities, that there is an imbalance between CD4 and CD8 cells, platelet hyperactivation. Well, this is just part of the first phase of inflammation, which we'll talk about when there are these adhesion molecules attracting neutrophils into the tissue, and ultimately macrophages coming in, and oxidative stress, obviously, more and more disease, much more virus, much more inflammation, much more problems with clearing viruses, leading to oxidative stress. Something as a chiropractor that I'm interested in is autonomic dysfunction, dysregulation between the autonomic nervous system, the sympathetic and the parasympathetic. And we're going to talk about the major nerve of the parasympathetic nervous system being the vagus, and how the vagus plays a role in COVID-19 and some things that you can do. Dendritic cell deficiency. Well, dendritic cells are these natural professional presenters. So they take the information or the debris that's been created by the inflammatory process, carry it through the lymphatic system to the lymph nodes, where in the lymph nodes, a combination of factors happens that determines what type of immune response is it going to be. Is it going to be a humoral response, an antigen antibody response, or is it going to be a T cell response, and what type of T cell? We know now that in COVID-19, post long COVID, there's hormonal dysregulation, erectile dysfunction, problems with periods. We've talked about endothelial dysfunction, complement system, meaning there have been recent reports talking about this part of the inflammatory process that doesn't get turned off. And this was an old theory looking at autoimmune disease, that the immune system just didn't have a way to shut itself off, and the person was in this continuous loop. We know now Parkinson's disease cases have shown up, people who might have a genetic predisposition to Parkinson's, once they get COVID, start to develop symptoms attributable to neuroinflammation. And of course, now some studies have come up looking at reduced serotonin and possibly the use of 5-HTP, because it's a precursor to serotonin, might be of value. So let's take a look again at a lot of slides from a lot of different articles proving the same thing, how the virus can affect so many different areas. You can see how it affects the endothelial tissue, which we'll talk about. Obviously, a common complaint when there's enough inflammation. So the way I present it usually is when there's enough inflammation systemically, because the inflammatory response isn't resolved. And for many of you, that might be a new term, but we want to get away from the idea of just giving supplements to reduce inflammation. If there's no resolution of the inflammatory process, then the cycle just continues because there's low-grade chronic inflammation. And those are the patients you're seeing in your office now, constantly with a whole host of symptoms that are attributable to unresolved inflammation. So when there's enough inflammation in the body, you start to get neuroinflammation, which we'll talk about. When you have neuroinflammation, that affects the vagus nerve. And we'll talk about the vagus because it's so important as the 10th cranial nerve, how it impacts not only gut function, but cardiovascular function. New studies have looked at SARS-CoV-2 affecting the heart, the increasing heart attack and strokes, how it can affect, obviously, since the ACE2 receptor is in very high prominence in the lungs. So just think it's not just the receptor being in the lungs. I'll show you a slide that shows other areas in the body where the ACE2 receptor exists, but it exists in the lungs, in the gut, and in the brain predominantly. So the possible adrenal involvement. So I always take this with a grain of salt, because many, many years ago, it seemed like everybody had adrenal insufficiency, functional hypoadrenia. You know, you stood up and you were dizzy, this dysautonomia, which is quite common in COVID-19. But I've come to realize it's not just the adrenal glands. The adrenals work together, so it's the HPA axis, the hypothalamic pituitary adrenal axis, the hypothalamic pituitary gonadal axis, the hypothalamic pituitary thyroid axis. So to me, many patients who come to me, regardless of if they have long COVID or not, and they're complaining and have been diagnosed, let's say, with low thyroid, they're probably dealing with adrenal dysfunction, and evaluating them and using the proper adaptogens like ashwagandha and rhodiola root, reducing their stress levels, meditation. There's a whole bunch of things that you can do, but it is interesting to look at that the adrenal glands are so important. Impaired vagal activity in long COVID patients. So I think this points out that when you have patients who are chronically ill and their cortisol levels are going to be very low, and if you do adrenal stress testing in your office, which I do, I find it very valuable to evaluate a patient's cortisol levels over 24 hours and see what's going on. You will see that in long COVID patients, they do have this loss of vagal tone. And remember, I said when there's enough inflammation, you lose the functionality of the vagus, which interacts with the adrenal glands. So the vagus is the 10th cranial nerve. It's actually the longest cranial nerve. It's referred to as the wandering nerve. It actually has two branches, a dorsal and ventral form. One part really is for the mouth, the nose, down to the chest wall, the heart, etc. And the other part, the dorsal part of the vagus nerve, goes all the way down into the colon. And they work synergistically together. And when the vagus is not working properly, then the adrenal glands are not working properly.